Welcome back, everybody, to the virtual tribal ALTSA HCS AAA Fall Summit. We are starting our second session, which is non-emergency medical transportation, which will be presented by Tracy Graves and James Walters, who are the NEMT program managers. I want to remind everybody that you are muted, and we will be holding a Q&A session in the chat box to the right of your screen. Feel free to enter any questions, and at the end of the presentation, we will be answering those questions at that time. So again, everybody is muted, and I'd like to go ahead and welcome Tracy and James. Welcome.
Good morning. Thank you for having us here today. My name is Tracy Graves, and I'm one of the program managers for non-emergency medical transportation. I will be presenting the first half of the presentation, and then James Walters will be presenting the second half. Next slide, please. So the purpose of our program is to provide access to necessary non-emergency medical services for all eligible Medicaid clients who have no other transportation resources. We also ensure broker compliance through performance-based contracts. An example of this is that our transportation brokers have the opportunity to earn a quarterly incentive if they can keep the lowest cost per trip lower each year. Long as it's lower than the previous year, they can earn an 5% up to 5% quarterly incentive. So that's an example of an incentive that the brokers can earn each quarter. We also maintain program integrity through data-driven program management and decision-making. And our data is managed in a program called DTUS, which stands for Data Tracking Utilization System. And we use this program to identify trends and review high-cost trips. Next slide, please. So the NET program is administered by the Healthcare Authority, and it's through 6 contracted transportation brokers that serve 13 regions. You can find our program roles outlined in WAC 182-546-5000 through 6200. A broker requirement is that they must staff a customer service center within the region they serve. And this actually benefits our Medicaid clients because when they contact our transportation broker, they're actually talking to a customer service representative that is familiar with the geography. So, for example, one of our transportation brokers, the name is Northwest Regional Council, and they serve Island County. And so when a Medicaid client contacts the broker, the customer service representative is aware that the ferry would be a mode of transportation available for them in that region. The broker is also responsible in ensuring all trips are to Medicaid covered services and for eligible clients. All transportation requests must be pre-approved through the transportation broker. The brokers also maintain a network of local transportation providers in their regions. And it's also the broker's responsibility to select the mode of transportation. And this is based on the client's medical conditions and capabilities. They're also looking for the lowest cost mode available, and they want to make sure that, of course, that ride is accessible. I want to mention that our transportation brokers are true brokers, which means that they don't actually provide the transportation. They contract with transportation providers, and it's the transportation providers that transport the client to their healthcare appointment. Next slide, please. So here's our broker map. And as you can see, there's 6 brokers that serve 13 regions, which covers 39 counties of Washington State. 5 of the transportation brokers are nonprofit organizations, and we have 1 government council, and that's Northwest Regional Council. And they serve Whatcom, Skagit, San Juan, and Island County. And the 13 regions are based on historical patterns and health care catchment areas such as Spokane and Seattle. Next slide, please. So it's the broker that arranges transportation to healthcare services within the client's local community. And we don't actually have a set number of miles to define local community. It typically starts where the city that the client resides in. Clients can also go outside of their local community if there's medical justification provided. And the broker will reach out to the client's primary care physician and request this information. It could be specialists too, but typically the medical justification is provided by the client's primary care physician. Clients do have a freedom of choice. They can pick whichever provider they want to see that, of course, accepts Medicaid. But as far as our program, we don't actually have to pay a higher cost for that trip based on the client's choice. And this is supported by our WAC, which is 182-546-5000, subsection 4. And it's also supported by the Deficit Reduction Act, 2005 Deficit Reduction Act. And what I mean by this is, let's say a client lives in Olympia, Washington, and there are several dental providers in the area that accepts their Medicaid coverage. However, the client wants to see a dental provider in Seattle. Well, the client does have that freedom of choice to go see the dental provider in Seattle. However, under our program, since there are several dentist providers that can accept the client's insurance in Olympia, the transportation request to Seattle would be denied because there are closer providers that can provide the same care. Okay, next slide, please. So who is eligible for transportation? Basically, it would be Medicaid clients that have no other transportation resources. They, of course, have to be Medicaid eligible, and that includes clients that have both Medicare and Medicaid. They're typically called dual eligible. They can only obtain services that is covered through their benefit service package that's medically necessary. So an example of this, let's say a client has limited casualty program, medical needy program, which is LCP MNP. Under this benefit service package, what's excluded is speech therapy, physical therapy, and occupational therapy. So if a client with LCP MNP contacts one of our transportation brokers and requests transportation to either speech therapy, physical therapy, or occupational therapy, the broker would let them know that they're not eligible for transportation to these services because it's not a service that's covered under their benefit service package. And all of our transportation brokers have access to Provider One to check eligibility, and they are very familiar of what's covered under the client's benefit service package. They're also familiar what's covered on the client's managed care plans if they're enrolled into managed healthcare plans. Also, the client must be receiving healthcare services through a healthcare provider that is either contracted with the healthcare authority or they have to be contracted with one of the managed healthcare plans. Okay, so James will be presenting the second half of the presentation. Thank you.
Next slide, please. Next slide, please. Thank you. So eligible clients should call their local transportation brokers to request transportation. We prefer that they would call in at least 2 business days in advance of their trips for their appointments. They can call up to a maximum of 14 days in advance to schedule the trips. We also can provide transportation for urgent care and for hospital discharges, but that's depending on the available transportation resources that we have at that time. Our program allows trips to urgent care, but not to the emergency department. We can, however, provide trips and transportation from the emergency department. Next slide, please. For modes of transportation, it's the broker's responsibility to ensure that the client's resources and lowest cost transportation mode is used first, and that's based on the client's mobility and capabilities. And the clients are screened by the transportation brokers for the most appropriate and the most cost-efficient mode. This list begins with the lower cost modes, and towards the end of it is the higher cost modes. As an example, public transit is a lower cost mode than a wheelchair van. And for the non-emergency medical transportation program to provide transportation, the clients must be safe to transport. We cannot transport clients that require to be secured, restrained, or transported in a prone or supine position. Next slide, please. Our healthcare authority contracted transportation brokers are encouraged to work with the tribes in their service areas. Many of the transportation brokers are currently working with the tribes. A billing agreement is required between the transportation brokers and the tribes, and the healthcare authority is currently in the final stages of creating a statewide billing agreement template, and this will be implemented with the transportation brokers once it's finalized. The latest draft will be shared with the Tribal Transportation Planning Organization soon. And the billing agreement that I mentioned is something that allows for tribes to be paid at a negotiated rate by the transportation broker to provide non-emergency medical transportation. And this is for members that are receiving services that are covered under their benefit service package. And we also require the brokers to post-verify trips after they've occurred to ensure that covered services were accessed. We also want them to keep their trip-related documentation on file. And the reason for that is the federal government audits it every 3 years. And the state auditor's office may also perform random audits, as well as the healthcare authority, which performs random trip reviews to ensure compliance. Next slide, please. For calendar year 2019, a total of $1.1 million was paid out to the tribes to provide non-emergency medical transportation. And the number of trips provided was 35,000. And the transportation brokers currently have billing agreements with 17 tribes, which are shown on that list there. Next slide, please. This is a list of all the transportation brokers, as well as the counties that they serve and their contact information. If ever you have issues with transportation, we recommend that you would reach out to the transportation broker within the county that you reside in. Next slide, please. This is a list of our program staff. Stephen Rills, the program lead, Tracy Graves and myself are the program staff. And the NEMT mailbox is a group email inbox that all three of us have access to. And if you've tried to resolve a transportation issue through the transportation broker and you still weren't able to resolve it, we encourage you to email us at that NEMT mailbox, and we'll look into that. Also, if you have any general inquiries, you can send those through the NEMT mailbox. And the NEMT website at the bottom there has lots of information about the program as well as how to use the program. Are there any questions?
Thank you so much, Tracy and James. Now is time for our Q&A, and again, to remind everybody that you don't have access to a microphone, but you can type in questions into the live event Q&A. And our first question is this for medical only, or would they have time to shop for essentials and pick up medications? Or is this a policy the tribe set up? So I think that's two questions. The first one, could a person who's utilizing the transportation services, could they do multiple trips and stop and pick up medications before they go to a doctor's or after a doctor's appointment?
Hi, yes, so we do provide pharmacy trips, but it's typically on the way to the appointment or on the way back, not just directly for a pharmacy pickup.
And then the second part of that question is this a policy the tribes set up? So do the tribes, can they say what the transportation services will look like and the number of trips that are applicable or available?
Basically, they can provide NEMT transportation. There's no set amount of trips. It's just basically, however many it ends up being each month. Does that answer the question, or?
Yeah, I think that answers the question. We can see here if there's more clarification needed.
I just wanted to mention the key thing is it has to be to a Medicaid coverage service. There's not a limit of the number of trips. You just have to confirm that it is a Medicaid coverage service. And that includes medical and dental and mental health.
I was curious now, when a client contacts a broker, is there additional forms that have to be completed or documentation? Can you describe that process in a little bit more detail?
I'm sure. So basically, a Medicaid client would contact one of the transportation brokers, and what they need to provide them is their P1 number, and that's 6 digits, and it ends with a WA. And then they will enter that in their system and then check to see if they're eligible for transportation. And then what they need is, of course, is, where the appointment is, the date and the time, and then they will schedule it. If the transportation is for out of area, they'll let the client know that they'll actually have to fax their primary care physician and get medical justification on why the client needs to go out of area. But all this, the screening and stuff is through the broker. The main thing that the client would have to provide is just the appointment. They need the address, the date of the appointment, and then the client's P1 number.
I'm really happy to hear about this service that's available, because as you know, that transportation is a tremendous barrier to accessing healthcare services, and we've heard it as a barrier over the years. So I was really impressed to see that you were serving a number of tribes and providing the 35,000 visits. But I just was curious again about the locations of the tribal communities, is that within a service area or is that outside a service area?
So to answer that, the service area could be outside of their local area. We do also look at culturally competent care. So if it has to be a little further outside of their local community that they need to go to, we take that into consideration, would allow that.
We have a question that came in. It says, can the client contact the tribe? And I'm assuming that's for to access those services, to request the transportation services.
So yes, the client can contact the tribe. The 17 tribes that James mentioned are the ones that actually have billing agreements with our transportation brokers. And so they're providing their own transportation. So if they're on that list, they can contact the tribes and request transportation through them. If they're not on that list, they can always use NEP services through our regular brokers and request transportation through them.
Great. Another question came in is, it says, would the Samish tribe be eligible for these services? And if so, how would they go about providing those services? Can we switch to one of our speakers to answer the question? James is going to take it.
So in order to provide NEMT transportation, they would have to have a billing agreement through the transportation broker. So whichever transportation broker is in their area that they reside in, that's who they would work with to complete a billing agreement if they want to do that. And then at that point, they can provide NEMT transportation and be paid for that. Thank you.
James, so can they contact you or Tracy for help with that?
We would prefer that they contact the transportation brokers directly because the documentation is kept with the transportation brokers.
I was just going to add, yeah, they can give us their contact information and then we'll forward to the broker managers so that they can talk to a manager directly. And so that group email address, the hca.nemptrans@hca.wa.gov, if you send it to that email address, we can get you in touch with the appropriate broker.
Great, thank you. Another question came in, asks if the care is with a specialist, is the justification still with the primary care provider, or is the justification through the specialist office?
Typically, it would be provided by the primary care provider because it's you typically need a referral from your primary care doctor to see the specialist. But if it's hard to get that information from the primary care doctor, the broker will also reach out to the specialist.
Great, and it looks like here we had a comment, the Northwest Regional Council is the transportation broker for the Samish Nation. Let's see here, does People for People serve Yakima Nation? Yes, James.
Yes, to my knowledge, they don't currently have a billing agreement with them, but they could if they want to complete a billing agreement, then they can provide NEMT transportation. Thank you.
Great. I was also curious, in terms of the transportation options that were available to people, can you just talk a little bit more? I was a little confused about the one option was a personal vehicle. Does that mean they would get reimbursed for using their own vehicle or getting a ride by somebody else? If you could just explain those a little bit more, that would be helpful.
Yes, so the personal vehicle could be the client's vehicle, or it could be, let's say they have a family member that also has a vehicle and they don't have one, then the family member could provide transportation, and then it would just be mileage reimbursement would be possible for that, or fuel assistance depending on what's needed.
Great, thank you for that clarification.
Hello? Sorry.
No, go ahead.
Okay, I was just going to add that, yeah, it can either be mileage reimbursement or they can get a fuel voucher and go to the gas station to get fuel. And the brokers will tell them what's needed for that. And typically it's like the driver's license, registration. But if you call the broker, they'll walk you through it and let you know what they need in order to get mileage reimbursement or a fuel voucher.
Another question came in stating the Yakima Nation FATO Transportation coordinates with People for People to provide rides to providers from the Yakima Nation to the city of Yakima. So there's some information there. Another question asks, where do people go to access that reimbursement piece?
So in order to get reimbursement, you would actually have to contact the transportation broker. And I think I mentioned earlier too that all of these trips would have to be pre-authorized through them. So you want to at least let them know at least 2 business days ahead that you want mileage reimbursement. That way they can process that for you. And then after the appointment, they'll when you contact them, they'll let you know what documentation they need to confirm that you actually went to your appointment in order to qualify for mileage reimbursement. And they also have forms that you would have to provide for them.
Okay, so there's no other questions coming in at the moment. We'll just give people a minute if they have any more questions or comments before we wrap up. Tracy or James, do you have any concluding comments before we wrap up our session?
I would just like to say, thank you for the opportunity to present this information, and hopefully it was helpful to everyone.
And I just wanted to add that, you know, we look at that email address every day, and you're likely to get a response within that day. So feel free to reach out to us. Feel free to reach out to the brokers. They're very knowledgeable. But yeah, if you have any issues, just contact us and we'll try to help resolve it.
Great. So just to remind everyone that handouts are available on the team site channel for this presentation. You can access it. I believe the slides will also be available. The session is also being recorded, so you can have access to this presentation at a later date. So our next presentation is at 11 o'clock. It is the IHS Reimbursement Agreement Program. So we will pause and give everyone a 30-minute break and look forward to seeing you all back here again at 11 o'clock. Thank you.